Green Fair Organic Cafe and Mike Young's plantbaseddiet.org, as well as our two sponsors, Mom's Organic Market and Evolution Vegan Academy. We're bringing you back with Chuck Carroll from PCRM Exam Room Podcast. He's going to be conducting an interview of my good friend, Dr. Baxter Montgomery from Montgomery Heart and Wellness in Houston, Texas. So welcome back, and hope you have a good talk.
Thank you, Gwen.
Thanks for having me.
I appreciate that. And Dr. Montgomery, it has been too long since our last chat. I believe it was it last summer at ICNM here in Washington?
Was it July or October? July maybe, huh?
July. Yeah, it definitely would have been summertime.
July. Okay.
Yep,
so that's been a while.
Yeah, the world has changed quite a bit in that time. Let's start with addressing the obvious here. How is the situation in Texas? I understand that you've actually been treating a number of patients who have had COVID-19.
That's correct. Just to give your audience a little orientation, I'm a private practice cardiologist, and I practice in Houston. We have the largest medical center in the world, and we see a lot of patients with lots of acute illness. And so my standard practicing patient with cardiovascular disease and related disorders, diabetes, hypertension, and the like. So when the COVID pandemic developed and progressed, and we got to the point where we started closing down institutions and even medical facilities started going on a reduced care. So we stopped doing elective surgeries, elective procedures and the like, and started gearing up for potential, coronavirus illnesses. So our practice, which, was typically very busy with cardiac patients, started reducing the office-based number of patients, and we started having an increased number of telephone visits. And so a number of our patients, who, of course, during the flu season have, flu-like symptoms, were calling in, and of course, we were going through the usual process of screening them. We did a telephone screen, patients in the office, everyone got a screen, a questionnaire screen at the front desk. Anyone with any suspicious issues were masked, and then we did further evaluations with temperature measurements. One particular patient of mine is a gentleman with congestive heart failure. I was doing telephone visits with him. He clearly developed overt symptoms, significant fever up to 102, severe headaches, and the like. And so his condition was progressing. So we managed him at home for a period of time. During that time, we have a protocol that we use that we've always used for patients with viral syndrome. So we didn't change that with this condition. We tend to put patients on a detox regimen. We increase the amount of antioxidant foods that they consume. We then, on a case-by-case basis, we may add supplements to that. So in that context with him, we added vitamin C. We had him take zinc supplements in addition to doing raw salads and smoothies. There's a immune boosting supplement we use, grapefruit seed extract. We had him take a certain amount of that for a couple of days. And this is a regimen we use with success with patients with illnesses. Typically, if a viral syndrome sets in for about 48, 72 hours, it may take it longer to be suppressed. Patients who, start this regimen at the first sniffle, maybe the first cough, they may suppress their illness right away. His condition had set in for a while when we started this, so he had a bit of a protracted illness. His illness got to the point where I think after day 8, he continued to have headaches and fever. He didn't get worse, but he wasn't getting better. So I recommended he go to the hospital. So we brought him into the emergency room. And the chest x-ray showed that he had double pneumonia based on imaging. So we admitted him. The pulmonary team, along with myself, took care of him. But his initial oxygen saturation was 93%. While in the hospital, we continued with the superfood regimen. He did not consume any processed foods. He may have had one slip up at home. But, with this regimen, and it was my interpretation, by the time he got to the hospital, he was starting to sort of plateau. And so after being observed for about 5 days, he had a full recovery and was discharged home. The follow-up with him is an outpatient. Of course, he became afebrile while in the hospital. Upon being discharged, his headache went away, his energy picked up. He had a subsequent initial COVID test was positive, so he was, infected. Subsequent test was negative. We've yet to test for antibodies. We plan to test for antibodies in our office pretty soon, and I suspect he should be IgG positive for COVID, so he's should be immune. So this is one example of a patient who went through the process, and with natural high dose antioxidants, some immune boosting nutrients, he was able to turn the corner, and his immune system is really what treated the disease, cured him of his illness. And that's really the point I like to emphasize. And some of the points I've emphasized before is that our cure, and I'll use that word, our cure for infectious diseases of any type is a healthy immune system. Our cure and treatment for cancer is a healthy immune system. So our body is designed to be attacked by foreign invasions, if you will, foreign entities, bacteria, viruses, fungi, the like. And our immune system is designed to protect us for that. It is our job to nourish our bodies to the point where our immune system is capable of doing the job that it needs to do.
Let me ask you this. There's so much still unknown about COVID-19. This is brand new in the scheme of things, even though it seems like we've been living in this lockdown now for seemingly forever. It's really only been a few months since it's been here on this earth at all. But how confident were you that that course of treatment that you were talking about would be successful in your COVID patients? Given that heart disease is one of the leading comorbidities, were you still very confident that this was the right approach?
Well, yes, because again, you look at disease states across the board. I mean, we say, okay, COVID is something new. I don't want to sound controversial. It's new, but not really. There have been coronaviruses that's been here before, and we've had them. It's a new type of coronavirus. It's new to our immune system. So there's some things about it that's different, but as we look at more and more data, the more and more data is coming out, it's starting to pan out to be something very similar to the flu in certain cases and other coronaviruses. So what seems to be very new isn't really new. I've been in this business and treating patients for a very long time. And every now and then there becomes a quote unquote new disease. But it's not always so new. It's just something that is a different form of something before. And so our body's immune system is equipped and designed to deal with anything, even though it appears to be new to us on the horizon. Our body's immune system is very smart and very capable. We may not have the ability to create a new drug, if you will, or a new vaccine, if you will, but our body is equipped to address it. And that's the magic of the human body. So that's why it's important for us to take care of our body. It doesn't matter what treatment, how powerful our treatments are. If our body is not equipped to maintain itself and heal itself, the body will deteriorate and be defeated. I don't care how strong the antibiotics are, the antivirals are. If your body is not well equipped, if your body is not properly nourished, it's ultimately your body's ability to heal itself that really controls your disease, whether you're talking about a broken leg or a viral infection.
Being brought up in our society, generally speaking, the rule of thumb is you're sick, you go to the doctor, you take a pill. Something's wrong with you, you go to the hospital, you have surgery, and then pills after that. Your approach is more focused on food. The patients who come to visit with you, how receptive are they to the message that, hey, let's go ahead and treat the underlying cause here as opposed to the symptom? Are they able to make that connection pretty quickly between their diet and their health overall?
Well, yes, we have a skewed population because we've become known not only in our region, but nationwide. We have patients fly in from all over the United States, East Coast, West Coast, based on what they've seen and based on what they've heard. So most of our patients coming in are sort of predisposed to that. However, we do get patients who come in who are a little bit new, don't know exactly what to expect. And we're pretty straightforward with them. The concept is so basic that once you just sort of put, you lay it out for them, most patients really understand that. The patients we have difficulty with, and that goes across the board, are patients who tend to be a little bit addicted to the food that they eat. So then if they're addicted to certain foods, then they will put up all sorts of excuses as to why it's not important to make dietary changes of the like. Patients who are not addicted to foods, who are willing to make the change, they make the change. We also have programs that are very precise and very short-lived, that gives them a chance to go through, say, a detox for a finite period of time, and they get very good results in that period of time. And that also helps them understand that experiential knowledge is really important. And that's one thing that's important with our detox program.
Being a former food addict myself, I know how difficult it can be for someone even to realize that they are addicted to food. For somebody who really has their heels dug in on this particular thing, what do you say to them to try to get them to move forward in a healthier direction? Or is your message kind of tough love, like you have to be ready to change, until then you're going to continue going down this unhealthy path?
Yeah, we have a number of skeptics. I remember one gentleman coming in, he's in his 70s, and he came to us because he was on a lot of medications. He was very fatigued and a lot of issues going on. And he was fairly argumentative. I mean, I would talk about, plant-based diet, et cetera, et cetera. And he said, oh, this is, so I put him on a raw detox. We go the opposite of what one would typically think